All right, Aaron, we'll check back. Tucson's medical community is weighing in on today's Supreme Court decision to uphold President Barack Obama's signature health care reform. The 5-4 ruling now makes it certain that major health care changes will move forward, touching virtually every American's life. Craig Smith in the newsroom with the reaction from Tucson's thriving medical community.
Guy, the health care plan is a legal football. It's a political football. It's an applause line for stump speeches and debates. But let's remember, whether you think it's a good idea or a bad idea, it affects patients and the people who care for them. Doctors, nurses, and other health care professionals see the human side of the health care law on their exam tables. The chief medical officer of Carondelet St. Joseph's says patients often concede they waited until they were so sick they were forced to come to the hospital.
Oftentimes we hear, even in these days, I couldn't afford to go to the doctor. I couldn't afford, they pay out of pocket for a care for dealing with this, so I just ignored it. I couldn't afford to buy my medications, so I just skipped the medications, and after a week without it, they ended up in an acute illness situation.
The health care law is designed to encourage preventive care, to catch diseases when they are easier and cheaper to treat. Carondelet is already working on programs to better monitor patients, keep their conditions under control, and keep them out of expensive hospital stays. We asked Carondelet Health Network CEO James Beckman how much of the law centers on how a patient will pay for health care.
I think that's a big part of it, but also there are other aspects of the legislation that begin to set expectations for providers, healthcare providers, to provide care in a more effective way and a safer way.
And that includes efforts to keep relapses to a minimum so a patient does not finish one expensive hospital stay and end up back in the hospital again. Now, El Rio Community Health Center makes a specialty of treating people who have trouble paying for health care. El Rio issued a printed statement praising the ruling and saying it could help up to 1 million additional Arizonans get health care. But El Rio is concerned about part of the ruling that gives the state more authority to avoid expanding Medicaid programs.
And Arizona's been cutting back on Medicaid.
It has in the name of budget cuts, and it would take expanding Medicaid, or access as it's called here, to ensure that additional 1 million people go under coverage.
Thank you for that information, Craig.